Hello, this is Stephanie Sear and Laurie Bogard presenting our evaluation plan for the Harrington Self-Wellness Program. Established in 2011, the Harrington Self-Wellness Program, or HSWP, addresses the reproductive health care needs of teens and young adults in South Central Massachusetts and Northern Connecticut. The HSWP provides education, resources, and referrals on human reproduction, birth control, sexually transmitted illnesses, pregnancy, and communication with partners and parents, with a goal of reducing unintended pregnancies and increasing self-wellness behaviors in the communities served. The purpose of this evaluation is to determine if abstinence-based preventative program outcomes and activities are implemented as intended and address quality standards, and outcomes are effective in reaching program goals. The findings of this evaluation can be used to identify and address program strengths and weaknesses, and determine if program components are effective in reaching outcomes. The evaluation will analyze two processes and one outcome of the program, as illustrated in the program logic model. The evaluation will focus on community-based preventative aspects of the HSWP, including in-person education around abstinence, reproductive health, sexuality, and prevention of STIs, and educational materials focusing on preventative measures, and will evaluate if these program facets perform as intended, if educational services are achieving participation goals set by the program, and if the abstinence program initiative is achieving desired outcomes. The program logic model displayed here illustrates the three areas the evaluation will emphasize, with one activity level, one output level, and one outcome level area of focus.
Evaluation question 1, which focuses on process-level components of the program, will use a post-test only analysis of the project group design. The activity will be analyzed in terms of how this facet adheres to the National Sex Education Standards in terms of content, delivery, and reach. The national standards serve as the indicator in this evaluation question. Methods used for collecting this information include interviews with program staff and facilitators to ascertain relationships between the national standards and the local practice, and analyze an analysis of program documentation to enhance data collected from in-person interviews. Data will be collected in an electronic database and will be analyzed once data collection ceases. Question 2, which also focuses on process-level components of the program, will employ a quasi-experimental design option utilizing the pre-test-post-test comparison group design where initial data collection occurs during implementation. The outcome will be analyzed by comparing enrollment numbers among the target group and all others. Methods used for collecting this information include interviews of program staff and facilitators, as well as reviewing program documentation. Data will be collected on the groups in an electronic database and will be analyzed once data collection ceases. Evaluation question 3 focuses on an outcome level component of the program. This question will also use a quasi-experimental design framework, utilizing a pre-test, post-test comparison group design with judgmental matching, where the evaluation is commissioned at the end of the program. Methods used for collecting this information include interviews of program staff and facilitators, as well as reviewing program documentation along with secondary data analysis. Data will be collected in an electronic database and will be analyzed once data collection ceases. The evaluation plan utilizes the quasi-experimental designs and employs a mixed methods approach to data collection and analysis, focusing on process measures and short-term outcomes as designated in the logic model. This evaluation is intended for stakeholders of the HSWP and will be disseminated internally and subsequently shared publicly. Data collected as a part of this evaluation include both qualitative and quantitative elements involving thoughts and insights from program staff and facilitators, program documentation related to how many participants enrolled, and the review of secondary data from entities including the Massachusetts Department of Public Health, the CDC, and UMass Memorial Harrington Hospital. Contextual factors, including cultural characteristics and demographics, will be collected and analyzed as well. Data collection methods will include in-person and telephone-based interviews with program staff and facilitators, inspection of program documentation for quantitative and qualitative analysis, secondary data analysis for statistical information on federal, state, and local levels related to sex education standards and rates of unintended pregnancies in the region. Stakeholders involved in this evaluation process include UMass Medical Harrington Hospital staff, HSWP program staff, HSWP participants, community program partners, including physicians, school guidance counselors, and funders, including the Massachusetts Department of Public Health. The results of the evaluation will be disseminated digitally to hospital staff, program staff, community partners, and funders, after which a meeting will be held to discuss results and next steps. The evaluation will then be released publicly to public viewing. There are references. And thank you very much.